Good morning. Good morning, everyone. Thank you so much for being here with us this morning for the groundbreaking ceremony for the future home of Healthright 360. We're delighted that you're here with us today for this historic moment. My name is Tricia Walsh. I'm the chair for the Board of Directors for Healthright 360. This morning we have a few brief speeches to commemorate the day, and of course we will have official groundbreaking with the golden shovel ritual and hard hats for the taking. Following the last speaker, we will tour the top floor of this building. You can see the medical clinic where it will be located and the renderings of the building. Without further ado, I am so honored to introduce you all this morning to the Mayor of San Francisco, the Honorable Edwin M. Lee.
Thank you, Trish. Happy New Year, everyone. All right. Well, as you know, I have been raised with the culture where health is everything. And being here at the center this morning with all of you here is exciting. But I also want to begin with a joke, and that is whenever I see Ben Fong Torres, I know it's back to the 60s. See, he's going to get me for that. Ian David Smith and others. But I wanted to be here, and certainly I'm enjoying this moment with Supervisor Jane Kim, whose district is here, because there's a lot of change going on in the city. And I understand that, and I know, and hopefully you know that I'm working really hard on a shared prosperity agenda, on an affordability agenda that really tries to take advantage of this prosperity that we're enjoying and try to spread it to as many people as possible. And so there's a reason, specific reason that I'm here today, and that is to celebrate Healthright 360's establishment of a new home, not just for them, but for the historic entities that they've been able to lift up for so many years. I know Wendy's here, I see Jeff Adachi, I see people from our Street Violence Intervention Program. I also see a lot of healthcare professionals here from UCSF as a donor, Kaiser Permanente, our own public health department that's here as well. And we're celebrating this because even in light of all the development in the city, and particularly in this surrounding location, there's going to be an anchor of health delivery of services that reflect the Haight-Ashbury Free Clinic, Walden House, the Asian American Recovery Services, the Women's Initiative that was here, Recovery Association, as well as just a history of entities that have been here, Lion Martin Health Association, health services that are also incorporated in the Healthright 360. What I've been saying to a lot of nonprofits throughout the city is, yes, there's fear that with rising real estate prices, you might be challenged in so many ways. But there's also the ability to take that and say, let's be a part of that development. Let's find ways in which we could sustain ourselves for years to come if we spend time finding the right partnerships, if we challenge ourselves to do even better. And so with this conglomeration of historically well-serving entities to come under a single roof, to have a brand new constructed building that can be a part of their home forever, I think is the best way to go forward. And I want to say, too, that we're going to add value to this area as well. Healthright 360 will not be alone in their effort to support nonprofits. Supervisor Kim is trying to do that through planning code, mitigations, through trying to get developers to pay attention to this, and we're going to do that when we face things like the Central Soma Plan, all the other areas where there's intense pressures to develop. We can develop correctly by incorporating historically used entities into the areas that we're developing. Right up the street, there's a number of city agencies eventually that will be housed into a brand new government building right across the street in the Goodwill building in a few years to come. And what I say by contribution is we're also going to take a look at the city-owned buildings that we have along Mission Street. And why not say now, early, that we're going to dedicate one of those buildings to local nonprofits as part of our development strategy. That should be part of this ecosystem that we have. I'm saying that early. I know my staff has said, man, you can't say that right now. We have figured out all the economics. But I think part of economics is about our values. That I don't think we can be successful unless we have basic values that support what we believe to be truly valuable to us. And community-based nonprofits have always been valuable. They've always been a part of the way we deliver services in the city. So I'm saying that early because I want to say not only a great welcome to Healthright 360, I'm going to say we're also going to try to build an ecosystem that complements what you're doing here today, because it's so important to recognize what this is. I'm also saying that a few blocks up, we're doing a new navigation center for our homeless population to encourage them to find the services that they need to hopefully navigate here. And this is what we're doing with our health department, our human services department, our law enforcement divisions, that we want a navigation center that really works for people that are finding themselves homeless, that get support services and transitions that into permanent housing with services there. So as a few blocks up, we're doing a lot of great creative things, but it takes kind of a creativeness of a Healthright 360 to then cause so many other things to happen. I was also joking as I walked in to say, I'm glad this is not another motorcycle, repair shop. But that we're going to do a lot of human repairing right here in this building. So I'm excited for that. This is my way of saying thank you to all the entities that have contributed, from the Board of Trustees to the funders, to Kaiser Permanente, to UCSF and the private donors who are here today. They're making all of this stuff happen. I know the Board of Trustees works really hard to raise the kind of money to pay good contractors like Dinwiddie and others to do the kind of work here. And I want to make sure that I find time to get up to that 5th floor, because this is exciting for the city. I also want to put it in the context that we are focused with kind of the additional revenue that the city has luckily gotten over the years, that we're going to pour it back into where people need it. Healthcare is one of those basics, but so is housing. So is ending chronic homelessness for our veterans. So is getting a mental health recovery program, just like what Dr. Eisen has worked with us in the CARES task force last year to start a respite center. And now we're taking it full-fledged. Let's expand that center. Let's make it a part of our whole healthcare system as we are challenged by our homeless population, all the drug-induced practices and behaviors on there. We can change all of that. I want to say, again, thank you to Healthright 360, because you're the fiscal sponsor of another important program. That's our street violence intervention program. And that's why I know Jeff Adachi's here, Wendy's here, Deanna Cho and others that depend upon not just good health care, but how do you get people away from violence? How do you intercede into that? And for Healthright to be a fiscal sponsor, that's an incredible part of that story. So I'm here to say really a big thank you for, I think, a picture already that you know of, that healthcare is at the center of anybody's recovery, but that we have to take it a little further with housing, with support services, but it's at the center of this. I am so gratified to see Healthright 360 to be here. So congratulations. Let's get on to seeing the 5th floor, and then let's get these contractors working, because I want to see this place open, and I want to see the ribbon cutting. Supervisor Kim is with us as well. Thank you.
Thank you. Thank you so much, Mayor Lee. Because the mayor has some official mayoring to do, we're going to do the ceremonial groundbreaking now so that he can continue on with the business of this fine city. We have 4 shovels that will be shared by the VIPs standing beside me, and with our applause, we will begin that official movement of the earth. Do you want a hat? Mayor's hat.
Hard hats, okay, excellent.
Contractor safety, right?
Move down this way. Move down, come on, move down, move down, move down. There you go. Everyone needs their dirt. Okay, just scoop it up and throw it right there. All right?
Don't make a look up.
Get your back. Okay, here we go.
I'm going to get everyone looking right here at this camera for 1 second. Great. Thank you.
All right.
Thank you.
Thank you.
Thank you,
Thank
everybody.
you. Please welcome to the podium the San Francisco Supervisor of District 6, in which we are located, the Honorable Jane Kim. Good morning.
Thank you. It is really, really exciting to be at this location. As the mayor and I welcome a lot of new housing and jobs in this district and this city, it's also been great over our tenure to be able to welcome new homes and updated, modernized homes for often our most vulnerable patients with the Soma Health Clinic and the Tom Waddell Health Center. And it is so great that we are able to also welcome Healthright 360 to the community as well with their updated and modernized homes. Our most vulnerable residents really deserve this level of health care. And as we open the new CPMC and as we open the new UCSF at Mission Bay, we want our health clinics coming along right beside it. Here, I think historically policymakers have often treated poverty as an economic issue. We look at housing and jobs as really being the answer to address and alleviate poverty here in this country and here in our city. But I think through so much of our work, and it's been really highlighted by our nonprofit organizations and by the Department of Public Health is just as an important of an issue for us to address as housing and jobs. We can't make our population healthier without access to proper health care. And we often think that not having enough money is the issue, but it also means not enough access to the health care that we need. And that we're not going to be able to stably house our population and provide jobs if people aren't physically and mentally healthy. And I just really want to thank our nonprofits because you are such an important piece and partner along with our hospitals in making sure that we deliver these services to our populations that are coming out of incarceration, that are coming out of homelessness or continuing to live on our streets, and those that are low income. I've had the opportunity of door knocking through our neighborhoods and communities when I ran for supervisor, both in 2010 and 2014. And so I would sometimes happen upon actually Walden House and Haight-Ashbury Clinic residents on Treasure Island. And when I was there, I would ask, what was this living experience like for you? How has this supported you? And it was nothing but the most positive comments. Not only am I getting the counseling and support I have needed for years, I actually have a community of folks that understand my experience that I get to live with and that get to support me. And so I'm building community and I'm building friendship, and that is also a part of my health and well-being. So on top of bringing and delivering these health services, on the other side, we've had this vacant building here for a long, long time. And I actually used to live across the block for about 3 years. And so this was an eyesore in the neighborhood. So on top of being able to deliver positive, healthy services to our community, this is going to be an activated corridor in this part of the South of Market. And that's going to be a benefit to everyone that lives here. So congratulations. I want to thank the board. I know this is a full-time volunteer job, along with the staff that make this happen. I know that Barbara Garcia, Department of Public Health, and Wendy Stills, Adult Probation, and Jeff Adachi also work in partnership with you to make sure that we are doing a 360 for our residents. You know, we talk about this a lot in the world that I'm in, but it's often sad that you have to go to prison to get health care and housing and meals and counseling. And we should be able to do that without sending someone to prison. It is about housing, health care, and jobs outside of that system. And Healthright 360 has been an important piece of that, and they will be able to expand from 5,000 to 7,000 lives. And that is amazing, 2,000 people. It doesn't sound like a lot when you're starting at 5,000, but when you think about each individual story in that 2,000 that you will be able to serve, that is going to be an incredible boon to the city. So congratulations to everyone involved. Thank you.
Thank you, Supervisor Kim. Please welcome the San Francisco Director of Public Health, Barbara Garcia.
Good afternoon, everyone. I can't tell you how happy I am to be here. I've worked with the mergers that have happened over the last several years. But one, I just want to acknowledge all the board members, past and present, of all the organizations that are now involved in HR 360. But just put your hand up. Okay. So I just want to acknowledge you. I have been, yeah, please. Nonprofit board represent the role of charity within our organizations. And you are responsible for the policy and the finance, and also in your supervision of an incredible leader, Vitka Eisen, and I want to acknowledge her as well. HR 360 is part of our network in San Francisco for the Department of Public Health. As you know, we're also opening within the year a new hospital, San Francisco General Hospital, new building. And part of the role that we will play with HR 360 is providing the specialty and the hospitalizations for the clients in which HR 360 is providing in the primary care system. But there's one thing I really want to recognize, that in the last couple of decades, substance abuse and mental health have been stigmatized services. And we have some of the most incredible leaders in this room today who have fought for the equity issue and the parity issue of substance abuse and mental health being recognized as a component of mental health. Just want to recognize Dr. David Smith, who's been an incredible leader around the country. And our work is not done in that area. And ACA, the Affordable Care Act, provides us an opportunity to ensure that we have an integrated model. HR 360 has taken that and embraced it, and I really want to applaud you for that, and congratulations for all your work, and thank you for your work today in opening this facility. So thank you so much.
Thank you so much, Barbara Garcia. Please welcome the representative from Kaiser Permanente, Director of Public Affairs, Randy Wittorp.
Well, it's a pleasure to be here today. I'm Randy Wittorp. I'm Director of Public Affairs for Kaiser Permanente here in San Francisco. And we're very excited to be a part of this project. And also, I'm so excited to see so many people turn out for this. It just shows the importance this clinic is going to have to the community. It's also kind of like a reunion, you know, when we all come together, all of us who are involved in community health. So Kaiser Permanente has been here in the San Francisco Bay Area now for 70 years. And from the very beginning, part of our mission, as well as taking care of the people who choose Kaiser Permanente for their health care, part of our mission is also to improve the health of the communities we serve. And so that provides me a tremendous opportunity to meet the people out in the communities who were so dedicated to improving people's lives. And we very much value being a part of that and knowing that when we come to a community, we're helping to improve that broader community, which is so important today as we see San Francisco gentrify. You look around the city, see all the construction cranes, hear about how rents are rising, all of the changes in the city, which are having a positive impact on the economy. It's very important that we make sure that nobody's left behind. So that's why on December 17th, our CEO, Bernard Tyson, along with Mayor Lee, announced Kaiser Permanente's contribution of $500,000 to support the construction of this clinic. Thank you. As part of our community benefit program, we work with the other hospitals in the city and very closely with the Department of Public Health, which is one of the best public health departments in our country. We're so fortunate to have the DPH as a partner. And we do a community needs assessment. And through that community needs assessment, different health indicators are identified, two of which were access to high-quality healthcare services and ensuring healthy and safe living environments. And so I want to acknowledge Healthright 360 because they're delivering on both of those things through the work that they do. They've taken Glide, Lion Martin, and Haight-Ashbury clinics into their program, provided stability for those programs, and that's very important to the thousands of people that go to those facilities for their care. And also, as Supervisor Kim acknowledged, and Barbara Garcia, the number of people who are going to be coming to this clinic and the increased capacity that will be provided when the clinic opens its doors. Some of the things they'll be doing are providing a welcoming intake center in the lobby, a primary medical clinic, a dental clinic, a fully stocked pharmacy, substance use disorder and mental health services, and a state-of-the-art resource center for housing and employment referrals, job counseling, and educational opportunities, including computer literacy. So this facility is really going to have the capability of changing people's lives. So I want to thank Healthright 360. I want to thank all of you who are here today. I want to thank the fantastic Public Health Department, Supervisor Kim, and just we very much look forward to seeing this facility opening its doors. And I think it's a really good example of how when all of us come together, there's so many people in this room from different occupations throughout the city, when we all come together, working together, we can make sure that people thrive. I had to get that in, okay? Thank you very much.
He's a little taller than I am. Thank you, Randy, and thank you, Kaiser Permanente, for all your support. Please welcome our last speaker this morning, but maybe the most important. Before we travel upstairs, CEO of Healthright 360, Dr. Vicka Eisen.
Wow. This is incredibly exciting. It's not like we do this all the time. I don't know, like if you're a university, you get to do this a lot. You have new buildings, and so this is maybe a once-in-a-lifetime experience. It's really an exciting project. So I want to thank so many of you for coming. I want to thank the mayor's office, thank Mayor Lee, Director Barbara Garcia, Chief Wendy Still, Supervisor Kim. Kaiser has been tremendous support for us. Our friends, I think the Community Clinics Consortium folks are here, our construction folks. I mean, it's really an amazing group of folks who are here, who came out to show support for this project. So you're all, we're all visionaries, right? So you can envision what this project will look like and what it will mean for San Francisco. 18 months from now, this old industrial building will house, as Randy said, it will house a primary care clinic, a dental clinic. It'll have a full-service pharmacy, really thanks to really a very generous donation from Eric Flowers in honor of his dad. It'll house our outpatient substance use disorder treatment and our mental health services. It'll have our resource center, which Randy described, all kinds of wraparound services to help the clients. You know, healthcare it's housing and it's healthcare, but it's housing and it's job skills and it's being able to use computers, and so we'll have all those services under one roof. It'll also have our central intake center, where we help, we assess client needs, and people are coming up behind me. I don't have issues. They got my back. If you rush me, they got my back. You know, you may not know this, those of you who don't know, but we house and treat 500 people every night in residential treatment beds or in sober living beds and in transitional housing. And so the central intake unit to access that will be here. This has really been our dream and our vision, so that whatever specific services brings a client in the door, they can get all the same services in a fully integrated, compassionate, thoughtful, and comprehensive way. In this way, we will help San Francisco's most vulnerable do as our motto says: we will help people get better, do better, and be better. In fact, it's going to be on the building. You'll see when you go upstairs. So, you know, I look up and down. When we came in, you look up and down this street and around this neighborhood, you see a lot of life and growth and vitality. You see tech startups and new businesses. You see all these young, vibrant people tapping away on their smartphones, right? It's really exciting. You see cranes building new housing and office buildings. And here we will sit in the middle of all of that growth, a brilliant reminder that San Francisco, while it welcomes its new business partners and celebrates their IPOs, because business is good for the city, right here in the heart of all this growth, San Francisco will not forsake its neediest and will remain committed to creating opportunity for those who have had so little. Now, I believe this is true. However, I still have to raise $15 million to make it real. And though this is not a fundraiser, I hope that you will spread the word about our good work and the importance of this project to the vitality of San Francisco today, and a testament to its legacy as a city that welcomes all. Thanks.
All righty, let's travel. We will be taking the stairs for those of you that are ready. And there's an elevator over in that corner for anyone that needs to take the elevator. We can fit 20 people at a time, take the trips upstairs. We have representatives from HDR Inc., which is Hathaway Dinwiddie, our construction firm, will be on hand for the plans of the building. Thank you.